Welcome back. Houston is home to the world's largest medical center, and we are so lucky to have the best in healthcare right in our own backyards, including our friends over at Texas Children's Hospital. Their West Campus in Katy is committed to helping even the youngest of patients. Joining us now is Matt Timmons, the Assistant Vice President of Texas Children's Hospital West Campus. Welcome to the show, Matt. And I understand your staff and you're not getting a whole lot of sleep these days, but the important thing is this West Campus over there in Katy, you guys are prepared for what could be an influx of patients with COVID-19.
Absolutely. Happy to be here and talking to you this afternoon. At the West Campus, Texas Children's Hospital West Campus, we're ready. We're part of a resilient organization, a resilient system, and we've been working across our Texas Children's system to adapt to this sort of fluid situation and make sure that we're responding to the needs, the ever-changing needs throughout as this sort of pandemic continues. Something that we've really focused on, we've taken a number of measures to elevate our screening processes, our screening protocols, so that we're limiting the number of folks who are on our campus and within our walls. So we've really taken to screening every patient, every visitor, every employee and staff every day at all of our entrances to our West Campus. We've worked with our visitors, our patients, to limit the number of visitors coming in the door. All of this really to ensure that we're providing the safest environment within our walls for our patients and our team members.
Last week, we did speak with Dr. Arrington from Texas Children's, and we were speaking specifically about that special isolation unit. And that unit is at the West Campus, correct?
That is correct. We are so proud of our special isolation unit. This unit is really designed specifically for children with highly contagious infectious diseases, just like COVID-19. It really allows our team of pediatric experts to care for these patients in a very safe, but a very sort of state-of-the-art environment. And I'm sure Dr. Arrington mentioned this when she spoke last week, but it's the only one of its kind in Texas and in the southwest region of the United States. And as a matter of fact, there really are just a few of these sprinkled throughout the country that are designated specifically for children.
But no surprise that one is right here in Houston, Texas. Let's talk about other medical needs outside of COVID-19. Let's say you're a parent out there and your child experiences some sort of other emergency. Like, let's say your child is playing in the backyard, they break their arm, right? Is it still okay for them to come to the emergency center during this time?
Absolutely, Derek. We're still here for the patients that need us, especially those patients that need that urgent care. Our emergency room is still open. We have been asking our parents and guardians, limit the number of people that you're bringing to the emergency room with you. Certainly, if you as the parent or guardian are feeling ill, maybe try to find another parent or another guardian who can accompany your child to the emergency center. But we're here at West Campus for the patients who need us.
Some parents may also be wondering, Matt, if they have a regular appointment, let's say they have a regular routine doctor's appointment or an appointment for something that is less urgent, should they still be trying to keep those appointments, or is there a specific protocol that might include first picking up the phone and calling?
That's a great question. So, really over the last 2 weeks, we've started moving a lot towards a telemedicine approach to our outpatient visits. And so what we've been doing is we're contacting patients who are on our schedules to come in and see their doctors, their providers. We're contacting them, and where appropriate, we're offering a telemedicine visit. That could be via telephone, it could be video, something similar to this. It's really, as deemed appropriate based on what they're coming in for. What we found is certainly this telemedicine approach lessens the amount of traffic in and out of our facility, keeping us, again, really protecting the environment. But another huge benefit is this is extremely convenient to be able to have a doctor's appointment, from the comfort of your own home. So we've gotten really great feedback thus far from many of our patients' families and our staff as well about the benefits of this telemedicine approach.
It is really incredible how telemedicine is the future. I did my first telemedicine appointment with my doctor a few months back, and it was so convenient because you still get that face-to-face doctor interaction without physically being face to face. All right, I want to shift gears now and just talk about you and your staff, because Matt, I know that during this time we've all seen these news reports of healthcare workers who are on the front lines, selflessly giving of their time every single day. What are you guys doing at Texas Children's Hospital West Campus, really to sort of care for each other?
So Texas Children's Hospital West Campus is a tight-knit group, a tight-knit team, and this may sound cliche, but we really are a really large extended family. It feels that way here. And so we've always been a group that supports each other, through our daily work. It's just a little bit more evident now in how we're really lifting each other up and supporting each other where needed on a daily basis. We're also really lucky and grateful. We are supported by we have lots of strong community support. You think about Katy, West Houston, there's so many communities around Texas Children's Hospital West Campus that support us and are standing with us. As an example, just over the weekend, sort of unbeknownst to us, a sign appeared on one of our lawns, a big sign that said, "Heroes work here." I certainly wholeheartedly agree that the team members that are on the front line taking care of our patients, they are heroes. And so all they had to do was look out the window, after a long day at work, or as they were driving away, they could see that sign to remind them there's an entire community that is standing with them, standing behind them, and really supporting all of us at Texas Children's West Campus as we go through this pandemic response.
That is such a fantastic story. Matt Timmons, thank you so much for your work, and to all of your team members and staff who are on the front lines fearlessly fighting this pandemic, we thank them as well. Thanks for your time today, Matt.
Thank you.
And a reminder that all week long we will be continuing the coronavirus conversation with Texas Children's Hospital. In the meantime, you can find more information by visiting texaschildrenscoronavirus.org.